Hello everyone, this is Roman Krivochnitzar, and I'll be showing you my technique for implanting a hydrous glaucoma stent. So the hydrous stent can be done either before or after cataract surgery. I typically like to do my mixed procedures prior to cataract surgery. Important to note is we want to make a separate incision for the hydrous, and I usually like to mark my incision outside of the temporal main wound so it's easier to find under the gonioscopy lens. So I just put in some topical anesthesia and some cohesive viscoelastic. This is what the Hydrus implant looks like outside of the eye. It's an 8mm nitinol implant with those three windows that you can see. Most important part to any mixed procedure is to have a good view of the angle. So we want to turn the head about 30-35 degrees, and I use a 25 gauge sharp short needle to score the trabecular meshwork first. This way I can pull down the trabecular meshwork and actually see the back side of Schlemms canal. That's that little white that you can see under the gonioscopy lens. This way I don't have to use the Hydrus implant to score the trabecular meshwork and to deal with trying to get the stent perfectly implanted. I already have my landing zone demarcated because I already have an opening into trabecular meshwork, and all I have to do is just gently place the injector against the backside of the Schlemms canal and smoothly insert the Hydrus Microstent. This should be a very smooth insertion. You can then push the microstent into Schlemms canal using either the injector as I'm doing here. Some people use a Sinski hook, but I always like to confirm that the microstent is well positioned. So I like to see all three windows behind the trabecular meshwork in Schlemms canal, and they should be nice and visible. This should be a completely painless procedure, and you should not see the Hydrus Microstent dive. If that's the case, you want to take it out and put it back in to make sure it's properly seated. So that's how you can use a 25 gauge short needle to create a little goniotomy and make your Hydrus Microstent implant significantly easier, in my opinion, and hopefully much less traumatic to the angle. Thank you.